Hi, my name is Jess Roby, and I'm a registered nurse. I'm also the president of the Professional Nurses Association here in Ulster County. Nurses have a primary responsibility to educate people about their health and about decisions that they might need to make in terms of maintaining their health. And to that end, we decided that it was important to make some videos about the COVID-19 vaccine, since a lot of people are trying to make the decision right now as to whether or not to get that vaccine. Having good information helps you to make a good choice. This video is not intended to replace an actual conversation with your doctor or healthcare provider about whether or not the vaccine is right for you, but is intended to give you some information to take to that conversation if you need to have one. In medicine, we talk a lot about the idea of risk versus benefit. So we're always weighing, is the benefit that might come from an intervention, a medication, a recommendation that we're going to make for you, does that outweigh the risk that might come along with that medication or that intervention? Every single thing we do in medicine, whether it's a medicine, a surgery, physical therapy, there's risk inherent in that. There's no perfect thing that has no side effect or unintended consequence. And so we are always trying to weigh what's better for you. Is it better to let you have your high blood pressure and do nothing about it? Or is it better to give you a medication that might bring down your blood pressure but might cause another side effect of dizziness or a stomach ache or that sort of thing? And so the vaccine is no different. So let's talk about the risks of COVID-19. So we know that one of the risks of COVID is that you could die from it. Some people have a higher risk of that outcome than others. If you're older, if you have comorbid conditions like diabetes or pre-existing lung disease, the risk of getting COVID and the risk that you would get a severe disease is higher for you. Aside from death, which happens in about 2% of cases right now, there's another 10 to 15% of cases that become severe disease, meaning people who are needing to be in the hospital and who are really sick for up to and beyond 6 weeks. And about 5% of people become critically ill, meaning that they end up in the ICU, and it's unclear as to whether or not they're going to make it out alive. And just to add to that, these folks who end up in the hospital, it's not, it's never fun to be in the hospital, but having COVID in the hospital also means you have no visitors, you have no contact with your friends and family other than through FaceTime, and it can be a very scary thing to be in there by yourself. There's also the risk that even if you don't end up in the hospital, that you might have an extended recovery period. People are taking 6 weeks, 8 weeks to fully recover from COVID. About 20% of people who do get COVID, even if it's not a severe case, are experiencing lingering symptoms, which means that they're tired, they're having shortness of breath or cough that won't go away. They're having chest pain or heart palpitations. They are experiencing mental health issues or confusion, brain fog, altered mental status, headache, nausea, vomiting, diarrhea, loss of taste and smell that goes on for weeks and weeks. Most of us don't have the capacity to just take a whole bunch of time off from work or our lives to take care of ourselves, so that can be problematic for people. Additionally, there's some data to indicate that even if you don't have a severe case of COVID-19, it can activate autoimmune disease. We don't know down the line what else, if COVID could be a virus that might lead to cancer down the line. We don't know. There are other viruses who are like that. There are other long-term damage that we are seeing in people, and we don't know how long it will last. People will have seemingly permanent lung damage to their heart, damage to other organs. There's mental health issues that are coming out of this, both from the trauma of having the disease or the illness, and just we don't know how much it affects the brain, and people have ongoing fatigue and joint pain. So there's a risk if you are not completely quarantined in your house that you could acquire this virus, and unfortunately right now we don't fully understand how it affects people or why it affects some people worse than others. So let's talk about the vaccine. There's always risk associated with a medication, and there have been a few reported cases of severe allergic reaction and a few reported cases of deaths associated with these vaccines. And while that's scary, it's very, very rare. And the way that we do medication and drug trials in this country, if you're getting the vaccine and anything happens to you, it's counted as something that could have been related to the vaccine, even though we have no way to know whether it was that or something else. The allergic reactions, if you get the vaccine and you have an allergic reaction, it's clear that that's related to the vaccine generally. And that's partly why they're giving the vaccine in situations where people have access to medical care so that they can get treatment for it. The folks who got the anaphylactic reactions were treated. They didn't even need to be hospitalized. So while it can be really scary, if it's handled appropriately, we do know how to treat anaphylactic reactions. The other things that can happen from the vaccine, you could get a headache, you could have pain at the site where you got the shot, your arm might be a little sore. Some people do get fever, a couple days of feeling fatigued. People are reporting chills. The side effects seem to be worse after the second dose than the first. However, it lasts about 24 hours and most people are back to normal a day or two later. Other than that, we don't have any indications that there are long-term side effects or adverse reactions to these vaccines. The vaccine's pretty clean. It's a little piece of DNA, or not DNA, mRNA in a fat bubble, and it works with your own body system to help create immunity. And we'll do another video to give you some more details about that. But from my perspective, the risks of getting COVID far, far outweigh the small risks associated with the vaccine, and the benefit of 94 to 97, depending upon which vaccine you get, Moderna or Pfizer, far outweigh the benefits far outweigh the risks of the vaccine. So questions you might want to ask your provider if you want to talk to them about whether or not you specifically should have the vaccine. What are the risks and benefits for you specifically, given your lifestyle, your current healthcare conditions? Do they recommend it for you? And if not, why? And then also, if you do have the side effects, what might they recommend you do to manage them? So I hope this helps. I'm going to post the resources from where I got the information and the data used in this video, because I want you all to question what you hear and make sure that what you have is accurate. Thanks for watching. Please share.